Well, good morning. There's increasing focus on the question of legalizing marijuana. Michigan has already approved its use for medical purposes, and the question of recreational use will likely come before voters next year. We're going to talk about the subject this morning, not so much to get involved in the pros and cons of that debate, but to get a better understanding of the challenges it presents for government at the state and local level. We'll start that conversation right now.
From TV6, this is The Ryan Report. Here's your host, Don Ryan.
Well, the firm of Friedman and Koski, based in Denver, Colorado, works to advise and assist various units of government as they navigate through the changing attitudes and regulations concerning marijuana. The firm's website says they're the world's leading experts in legalization and community involvement regarding that subject. Louis Koski is the firm's co-founder and senior director. He previously served as the director of the Colorado Marijuana Enforcement Division. He's in the area to speak to the Economic Club of Marquette County, and he's our guest this morning. Welcome to the Ryan Report.
Thanks for having me.
Nice to have you with us. You know, the name Koski is a familiar name in this area, but your roots aren't from this area, are they?
Well, they actually are. I was born and raised in the northern suburbs of Chicago in Illinois, and my family's of all Finnish descent from Orr, Minnesota, north of Duluth.
Okay. Before taking on this position you had in Colorado, what was the career path that kind of led you to that assignment?
Well, I was a police officer in a town just outside of Denver called Arvada. So I was a police officer in Arvada, Colorado, and while I was there, I was going to grad school, getting a master's in business administration with an emphasis on international business. Okay. At the time, I just didn't realize that the two were going to complement one another so much, and I ended up going to work for the casino gaming division and help them formulate a financial investigation section.
Okay. You know, before we get too long, I think I want to make too far along in this discussion, make one point. Your firm is not intended to advocate for or against marijuana, correct?
That's correct. We're completely agnostic on marijuana legalization.
Okay. So what are the services that your company provides?
We really focus on trying to help government once that policy decision's already made. So we neither advocate for or against marijuana legalization, but we've recognized that it's a growing trend with state and local governments across the country and quite frankly around the world. And so our primary focus is to work with government agencies who've been tasked with implementing some form of permissive marijuana policy and just to help try and do what they can to make sure they get it right the first go around.
So these would be local, county, state units of government, probably?
Exactly.
Okay. You know, marijuana is still illegal in the eyes of the federal government. How is that impacting what's happening around the country?
Well, it certainly has an impact. In a lot of ways, it has not been enough to slow down the courses that many states have taken, where they've implemented more permissive marijuana policy, both on the medical side and on the recreational side. On the other hand, since the disparity still exists, there's still a fair amount of unresolved policy issues, and most of those policy issues can be traced back to the fact that there's a disparity between federal and state law. Banking use, pesticide use, and research.
The Obama administration kind of took a ignore it position, I guess, just kind of let it take its course. Is there any indication that that outlook could change with this administration?
It's really difficult to tell right now exactly what stance the current administration is going to take over the course of their term. One thing we know for sure is that there's been a lot of talk at the federal level about how this administration is going to proceed. We don't know whether it's going to be enforcement of the actual regulatory structure, or if we might see an increase in enforcement around licensees or participants in the market who are not in compliance with all the state laws and regulations. So right now we're kind of taking a wait and see approach with the current administration, and we'll have to respond to that when they decide what direction they're going to go.
Is this one of those things where it's kind of out of the box and would be hard to put back into the box?
I think to a large extent it would be. And again, you know, when we look at the potential for federal involvement in this, we tend to think of it in terms of whether or not there's going to be increased enforcement or not. And so when we think about the increased enforcement, we wonder whether it's going to, if it happens, whether it's going to be directed right at licensees who are compliant with the state laws, or ones who are non-compliant with state laws, or actors who are altogether not even participating in the regulated market. The latter of those three, I would argue that increased enforcement from the federal government would be welcomed, because it tends to cloud the credibility of the regulated marketplace.
According to your website, there are now 29 states that have legalized medical marijuana, and I think 8 recreational marijuana with access to about 67 million people. Is there a trend here? Is it increasing?
It's definitely increasing. So 29 states have medical laws on the books. 8 of those are adult use. The conversations that we've been having with people as we travel around the country is that there's likely going to be, as many as a half a dozen or more states that entertain adult use marijuana in the 2018 election. And so even though there's more uncertainty and ambiguity at the federal level, there's still a lot of conversation about increasing, there's still a lot of conversation about other states starting to take on a similar policy position as like Colorado, Washington, Alaska.
What do we see around the world? How is marijuana accepted on a global basis?
Well, it's kind of here at a national level, we're always talking about the disparity between federal law and state law. When you start talking about it from an international perspective, it invokes all of the treaties that have been formulated over the last 20 or 30 years related to drug policy in general. And so I think what's happening, we're seeing countries rather than states and local jurisdictions here nationally. We're seeing countries that are looking to legalize. Just north of here in Canada, they're in the process of going through the implementation of legalization of cannabis nationwide. Uruguay has already taken on the process of legalization. And so I think what we're seeing is a broader discussion about drug policy in general and the relative merits of the war on drugs and how effective it's been.
Okay. We're going to talk about Michigan in just a couple of minutes. Back with more on the Ryan Report after we take this break. Our guest this morning is Louis Koski, here to speak to the Economic Club about marijuana. And again, not as an advocate or an opponent, but to help local governments and state governments deal with the issue. You served as the director of Marijuana Enforcement Division in Colorado. What were the major issues you had to deal with in that assignment?
Well, I think the biggest issue was we were amongst the first government agencies to head down this path. So we really didn't have anything in place when we got started. We didn't have regulations. We didn't have office space, employees. In fact, there for a while, we didn't even have paper clips. So we had to start from scratch. And so I think that was probably one of the bigger challenges. And so a lot of times as policy issues percolated to the top, we were always amongst the first that were dealing with them.
What was it a problem and perception that you were from kind of a law enforcement background? Did people make assumptions that you would try to take things in a certain direction? Or?
Yeah, I think it depends upon who it was. There was a lot of mixed emotions around it. So I did come from a law enforcement background. Some of my closest friends in law enforcement were concerned enough that they were talking about doing an intervention because I was involved in licensing these businesses. But I think there was a concern out of what would become the regulated community that we would take a very heavy-handed approach to that. And as it turns out, we were really focused on taking a good government approach to it. So for us, it was really important, since we didn't know a lot about the cultivation of marijuana and infusion of marijuana and some of the other actual business components of it. We really needed to rely on those prospective licensees to help educate us. And as a result of that, we really instituted a lot of good government processes where we really engaged different stakeholder groups, so we could really understand all of the viewpoints on the different components of regulation.
So if you came into that job with some convictions, you kind of had to put those aside, right?
You absolutely had to put them aside, and our role was different. So my role as a police officer versus my role as the chief regulator were two completely different things, and it was really incumbent on us as the regulator to make sure that we had really sound public policy that put public health and public safety first, but also recognize the fact that we weren't there to put the businesses out of business.
It's a pretty broad question, but were there some really key lessons you learned as you went through this process?
Yeah, I think one of probably the biggest lessons we learned is that it's exponentially easier to implement a regulatory framework when you don't have people already operating in the space. So we were trying to on-ramp businesses that had been operating in the unregulated environment for several years, and trying to get them into a comprehensive regulated structure was really challenging. In addition to that, right after legalization, and we had a change in consumers, so we went from a patient-based consumer pool to everyone who was over 21 years of age in the state. We realized that there was a lack of education around edibles, and so we had to do a lot of work with edible regulation to ensure that the product was packaged properly, so it was child-resistant packaging, that we had the right messages on the labels, and that when product was outside of the packaging, it could be recognized as a marijuana product.
And you really went from a illegal product in some ways to a product that now had to meet a lot of different standards.
That's correct. The amount of regulation that we adopted over a 2 to 3 year period of time was a huge change for the industry. And so along with that came some pretty significant costs to regulation, not just the cost of buying or applying and paying for the license, but there's a lot of equipment costs, there's a lot of labeling costs that go along with creating the entire regulatory structure.
Okay, Michigan in 2008 approved medical marijuana. I think there have been a lot of complaints about the system. We passed some new regulations this year, some new laws. Are you familiar with the Michigan system, first of all?
I'm a little bit familiar with it. I wouldn't say I know it really well, but I'm somewhat familiar with it.
Okay. One of the issues has been, the basic program was that a caregiver would provide marijuana for 4 others. And instead we've seen a development of dispensaries, and there was a story in the Detroit Free Press just today about how in some counties that they enforce the law very strictly, and other counties they don't at all. So what does Michigan have to do to get this right?
Well, I think there's some signs that they are starting to get it right. Last week I heard that there was a meeting between the regulators and the vendor with the seed to sale company to try and socialize both some of the regulations and the concept of using seed to sale tracking as an inventory tool. From what I understood is there's like 2,000 people that showed up to the meeting. And even though it's just a meeting where 2,000 people show up, there's a lot of things that you can pull from a meeting like that. For one, you have government officials who are showing up to a meeting with 2,000 people at it, and they're willing to be there for the meeting. That suggests to me that their superiors are supportive of what they're doing, and that they're feeling good about what they're accomplishing, and that they really need feedback from the public to really be able to take it to the next level.
That's have to have quite a meeting place for 2,000 people.
It was a big meeting.
Okay, we have to take one more break. I'll be back with it in just a couple of minutes. Back with more on the Ryan Report after we take this commercial break. Again, this morning our guest is talking about the subject of marijuana, and let's talk about Michigan. It now appears that the question will be on the ballot probably next November. What can we expect to see, as far as the campaign goes, first of all, based on what you've seen in the past?
Well, first of all, I think it's not terribly surprising with the current model that you have in place, where caregivers are allowed to care for a certain number of patients in terms of getting them the product. To see that start to transition more towards a commercialized marketplace. In fact, when you look at the medical side of the business, and you look at the list of ailments, anytime chronic pain is one of the ailments, it tends to really drive patient numbers up. And so as more patients come into the system and are registered, it becomes harder and harder for caregivers to really consistently provide product to them. So the commercialized piece. That also has an impact on, to a certain extent, the normalization of marijuana in your state, which then oftentimes leads to what you're talking about now, which is a campaign to actually legalize it for adult use. You really see the battle lines drawn relatively quickly when that kind of policy is presented. So on one hand, you're going to have people that are really concerned about increased consumption. You're going to have, which then leads to concerns about increased problems on the roadways, youth use rates. There's this assumption that all that's going to go up. So there's going to be some concern on that side of the issue in terms of of trying to prevent the policy from being successful. On the other side of it, you're going to hear about taxes. You're going to hear about how this can generate a lot of revenue, and how it's probably better from their perspective on having been legalized, so you can do a lot of the things that we've seen in other states with packaging and labeling and product safety and public health and safety concerns still being addressed. So those are really kind of how you're going to see things probably develop here in the state as people start to entertain the notion of legalization.
And you hit on a couple of key points there. Number one, does it produce tax revenue in the states where it's being used?
Yeah, it absolutely produces revenue. I think the assumption that it can fix budget deficits for states is not accurate. Okay. In Colorado, for example, the actual tax revenue that's generated from this is less than 1% of the state's budget. Right, it hovers right around 1%. Okay. And so, since it's only 1%, it's not going to fix your roads. It's not going to pay for education. It's not going to cover any billion-dollar programs. But the money can be used for good things. So it can be used for school reconstruction, like it is in Colorado. But it also can help to focus on programs that have some nexus to substance abuse and marijuana legalization.
What about putting more impaired drivers on the road? What's been the experience in Colorado?
So a lot of that data is still being established right now. One concerning data point is that we've seen an increase in fatalities, and we've also seen an increase in people who are killed in car accidents testing positive for having some form of THC in the bloodstream. Even though that is certainly alarming, and it would be irresponsible not to be concerned about how that's going to how that's going to trend over time and what kind of policy changes you might want to have. It's also irresponsible to assume that marijuana is creating more deaths on the roadways. Okay. So we just need more time, as we've established baseline data, to better understand even though we can test positive for THC, we can't test to determine whether or not there was actually impairment from it.
We just have a little over a minute left. Mm-hmm. What will be the key for Michigan going forward if this is approved? What will be important for the state?
Well, so when we get a chance to talk to policymakers, we're always wanting to make sure that they understand, even if you are adamantly opposed to the concept of legalization and it passes, you can still have strong feelings about the relative merits of the policy and still be really intimately involved in the implementation of the program. Because once it's passed, it's irresponsible not to take up the banner of implementation and make sure that you're still implementing public policy that balances both public safety and health with the needs of the businesses to be able to survive.
And public safety and health involves both people who use the product and those who don't, right?
Absolutely, yes.
And so do you feel Colorado has set a model that Michigan can look at?
I think that Colorado has definitely done a good job setting a model that can help states get started. I think we still need to be thinking of more innovative ways to leverage technology over time to really be able to take what we know to be version 1.0 in Colorado, Alaska, and Oregon, and really start to use that information to then create unique policy alternatives as other states come on board.
Are we likely to see a lot of national advocates coming into Michigan during this election campaign?
There's a really good chance they're probably already here if it's heading down that road.
Thanks very much for coming in this morning and talking with us.
You bet. Thanks for having me.
Fascinating subject. I'll be back with some other thoughts for you in just a couple of minutes. Well, today I'd like to talk with you about a potpourri of unrelated items. I like that word, potpourri. Of course, if you're well versed in vocabulary, you realize that statement is redundant because the modern definition of potpourri is a collection of seemingly unrelated items. I say the modern definition because the term potpourri commonly referred to a mixture of dried fragrant plants, often placed in a decorative bowl, which is used to provide a pleasant natural scent. The term comes from the French word potpourri. According to my sources, the word pot in French has the same meaning as it does in English, while the word pourri means rotten. Rotten things in a pot. Kind of takes away the charm from that bowl of potpourri you have on display. But let's move on to those other related matters. How rich do you have to be to pay $450 million for a painting? That's what happened the other day. According to one report, the Leonardo da Vinci that sold for that astounding price at auction had at some point been touched up and 50 years ago it sold for less than $10,000. Apparently at the time there was some question about its legitimacy. But the question remains, how much money must you have if you can pay almost $500 million for a painting? I think the answer to that question is a lot. On the subject of money, we have now apparently reached a point in this country where a lot of people are willing to pay $1,000 for a telephone. Apparently that's the going price for the new iPhone X or 10. I realize my vision on the subject is affected by the fact that for many years my telephones, which were attached to the wall with a cord, just came as part of the service. Of course, it didn't take pictures or let you surf the internet, but it was pretty reliable when it came to making telephone calls. It would also tell you the time if you called the operator or dialed the right number. And finally, can you remember when a coffee shop was just another name for a restaurant? They served coffee, but they also offered a fairly full menu of things to eat. In recent times, we've seen more coffee shops opening, but their mission is actually to sell coffee. And when I say more are opening, at least in Marquette, it's a coffee shop boom. Of course, one of the reasons is because a cup of coffee costs quite a bit more than in days past. We've come a long way from the time when coffee in a restaurant sold for a nickel or a dime. In fact, as late as the early 70s, you could buy a cup for a quarter. And some of you may even remember when there was a time when finer restaurants threw in the coffee at no cost when you purchased a meal. You can expect to pay a lot more than that today for a grande vanilla latte, although it doesn't come close to the cost of that $450 million painting. If old Leonardo could only know, and maybe he does. I'll be back in a minute. That's all the time we have for this week. Keep in mind, if you missed the show, you can watch it anytime at uppermichigansource.com. Previous shows are there now. The show we just had on today will be available tomorrow at about noon. Thanks to Louis Koski for joining us today to talk about his experience in marijuana in the state of Colorado, a controversial subject, and we'll probably get to know a lot more about it in the year ahead. That's our show for this week. Thanks for joining us. Look forward to seeing you again next Sunday morning.